You now select the point where you want to
So
inject.
I would go back to the point where which I chose initially, because that seems to be the most reasonable site of injection to me in this particular case, and that would be right behind the perforator in a direction that is opposite to the flow, right here. This is where I would like to inject.
Okay. The needle.
Yes.
19 gauge.
19 gauge. 2 ml of glue. Let us look at the velocity.
Liperdol, no Liperdol?
No Liperdol.
No Liperdol.
So if we are injecting without coils, then we want rapid polymerization. So it means dextrose, no Liperdol, rapid injections.
Dextrose?
Dextrose. Not saline, but dextrose.
Can you remove the color Doppler?
No, I would like to keep the color Doppler till the time that I am going to inject.
Okay, sure.
So the vessel on the right side is the afferent vessel on the extreme right.
Yes, so this is the afferent vessel. This has the flow towards the transducer. Yeah. We have optimized our flow velocities so that we are detecting only high flow, so that aliasing is gone, and now we can.
Now we'll take silence for 2 minutes.
Right.
You do it now. We don't speak. Nobody speaks. No questions asked. Unless you want to speak.
Except Malay.
Are we ready?
No, only
we are only injecting glue.
2 ml glue. 2 ml glue and dextrose. That's all.
So I want. So what are we doing? We are doing here. Can somebody please focus on what Rahul is doing? We are agitating the dextrose. In this case, we have spent a lot of time to determine what is the inflow and outflow. But if not that, then this is our final assessment of the direction of flow. Now I am going to take away the color. All right. So now we have anechoic lumen. So our dextrose will tell us what is the injection, what is the direction of flow.
Okay. So you are injecting dextrose.
Yes, we are using dextrose, sir. Is the glue ready?
So 1 second. What you have done is, you have now removed the color Doppler.
Yes.
You know where you are going to inject. You are going to inject. You have taken the stellate out, and you are going to inject agitated dextrose into the needle and see whether the bubbles flow into the submucosal varix.
That is correct.
Okay.
So that is my final confirmation, because one thing that we absolutely do not want to do is inject in the wrong direction, because when we are injecting glue only and not using coils, if we inject it in the wrong place, that can be disastrous.
Okay.
If we inject in the right place, we are absolutely fine. So here we should have flow coming towards us. So, okay. Ready?
You want somebody to stabilize your scope?
No, we are good. Okay. So ready? So one more point that we currently are not using, but I would definitely recommend to use eye protective goggles, because this is very close to our eyes, very close to the assistant's eyes. Do you want to use a footstool? Because it has to be a rapid exchange. You're good? So for now, I'll keep my eyes over here, but I would definitely recommend that we use eye protection goggles. Laga na? Laga do? Ready? Yes. All right. So now we are in. Okay, inject. So we know that we are in the right place. Our direction of flow was correct. Inject. 2 ml glue followed by dextrose, quick flush. Yeah, you can see that the glue cast has formed right there. It has not gone anywhere. Flush 5 ml. Yes. All right. Needle out. Needle out. So in India, we sometimes want to conserve our needles, so we would want to immediately put acetone in the needle, and if we need a second injection, that would help. here we can see that the varix is gone. We can see that the glue cast is right here and it has stopped right at the exit. And
so has it gone a little bit out? Not yet out.
no. It's right here. The whole glue cast is a part of.
Yeah.
So let us put some Doppler. And now we want power Doppler. No. Where's the power
This
Doppler?
is this E-flow.
E-flow. So we can see that the glue cast has completely obliterated this varix. All right. And we have almost no flow in the outflowing perforator.
But I believe you had injected just after inflow, not
Yes.
before inflow.
No, I did not inject before inflow because I did not have a clear path to
Okay.
inject before
So
inflow.
you agreed with me, na?
Absolutely.
No, but you
I
agreed
cannot.
too late.
I cannot not agree with you.
So that was a fantastic demonstration. We can start the other case, and that was a fantastic words of demonstration and the logics and the velocity and so. And I think for everybody it is a great game changer. It is a game changer. The demonstration. We have taken to so much of time.
Can
So
I
we are-
take 30 seconds more?
Yeah,
If I
you
can just
take.
show this.
You're
So,
done.
so this is the inflowing vessel now. We see the whole inflow vessel is thrombosed. So if we inject right after the inflow, that is also okay. We have to inject at the right place. Now we see the inflowing vessel is thrombosed.
Slowing down.
It
Slow.
is almost gone.
Ah.
It is almost gone. We
It
see
went-
no flow.
Yeah.
And here is the outflow. Outflow is anechoic. So none of the glue has gone anywhere outside and there is almost negligible flow. We can put in pulse wave. We can demonstrate this. Update. So from the 20 centimeter per second flow, we have this artifactual flow that is going to go away in a few minutes as the full thrombosis happens. We can see the glue cast over here. This is the varix over here. This is the inflowing vessel. And we'll trace it back all the way to the portal side where we can see some air from the air that we injected. And this is where the feeder is rising from the portal circulation. And we see the whole area is anechoic. So nothing has gone proximally, nothing has gone distally. The varix is occluded. We are happy.
Yeah, we are happy.
And we have saved so much money.
We have saved too much money. That is a good head profit.
So we could have placed coils, but as we have over time we have devised that using coils increases the cost without really giving us a lot of benefit. This is our. We need validation in multi-center, randomized data, but our observational data of about 66 patients, of which 15 had coils and the rest were without coils, we saw no difference in outcomes. So, the procedure time is reduced, cost is reduced. Overall, I feel reasonably happy using undiluted glue when injecting against the flow. Pure glue is good enough.